So did you know that there are certain vitamins which can cause an overdose? Those are the fat-soluble vitamins, A, D, E, and K. And while these are vitamins, they're essential for our health. We have to get them from our environment, from food. Too much can actually be an issue and cause health problems. So vitamin A, the first one, it's important for vision, immune function, cell growth. The recommended daily allowance for adults is 700 to 900 micrograms of the retinal activity equivalent, RAE. And the upper limit of intake that's recommended is 3,000 micrograms per day. Those are the official recommendations. Overdosing on vitamin A can lead to like liver damage, headaches, dizziness, nausea, all kinds of other issues. So also long-term high intake can be bad for bone health and cause liver issues and can potentially contribute to birth defects. So it's important to have enough vitamin A, but not to overdo it with vitamin A. Sometimes people take a lot of vitamin A for skin issues, right, to lower like acne risk. But just have to make sure that you're within some reasonable range there. Vitamin D, this one is a little confusing and there's like disagreement because the old recommended daily allowance is like very low, you know, officially like 600 to 800 with 4,000 as like the max daily. But many clinicians now are like, that's not enough, we need more. Like, you know, if you only supplement that much, people will still be in deficiency. So it might be more, right? But too much can be a problem. It can cause weakness, vomiting, hypercalcemia, right? It can result in like vascular issues, tissue calcification, heart issues, kidney issues. So important to like not overdo it, right? So there's the once a week type, that's 50,000 international units. Don't take that one every day, right? That's something to take once a week, right? And even 10,000 a day, which is sold over the counter, that might be too much. So be careful. Okay. Another one is vitamin E. That's an antioxidant, protects cells from damage. The recommended amount is 50 micrograms and the max is 1,000, right? So it's a big range. Too much, it can cause issues for blood clotting or hemorrhage risk. It can interfere with the absorption of other fat-soluble vitamins. So there were some other concerns also from other research. So it's, you know, it's probably not necessary to supplement at high doses for vitamin E, just get it from food. Vitamin K is another confusing one, like it's essential for bone health. It's essential for blood clotting. The recommended daily allowance for adults is 90 to 120, and there's no established upper limit for intake from food of vitamin K. But the synthetic forms of K, it is possible to overdo it. It's rare to have toxicity from vitamin K, but it can happen and it can interfere with anticoagulant medications. So in general, from food, no issues, and with supplements, just keeping the doses within a reasonable range. In general, we may need to take vitamins because our food is not that rich in micronutrients. And at the same time, like it's possible to overdo it, especially with the fat-soluble vitamins. So good to have a doctor involved, to run your regimen by someone, to check blood levels, to monitor for any signs of toxicity, and don't overdose, right? So stick with reasonable dose ranges, especially of these vitamins. And if you are going to take mega doses or unusually high doses, you should definitely have some guidance. You should definitely have a healthcare professional to help you figure out what makes sense and how to make it safe.